Introducing a new Propeller Turbo Tip that enables surgery that is gentle to the eyes. Today, most cataract surgeries are performed using phacoemulsification and aspiration devices, or PEA. There are two ways to oscillate ultrasonic waves: longitudinal vibration and torsional oscillation. Each has its advantages and disadvantages. With the longitudinal vibration method, cavitation is caused on the surface of the phaco tip to crush and aspirate the nucleus. Since the tip is straight, it is easy to handle, but it is liable to repel a hard nucleus. The torsional oscillation method, on the other hand, causes cavitation on the side of the phaco tip, so it has outstanding crushing power. However, due to the shape of the tip used exclusively for torsional PEA, it is liable to cause tissue damage, such as to the iris. This shows a case in which a tip exclusively for torsional PEA was used. Because the tip is curved, it has poor operability. Surgeons thus need time to get used to operating the device. Since the end of the tip moves vigorously, it has outstanding crushing efficiency. However, because of its distinct shape, we often experience damage done to the iris and incision wounds, as you have just seen. We therefore developed a new phaco tip, a Propeller Turbo Tip, that solved the problem seen with conventional phaco tips. The Propeller Turbo Tip has a total length of 30 millimeters. It is a straight tip embedded with a vertical plate 1 millimeter from the tip. By causing cavitation from both sides of the plate as well, the tip can make the most of the effects of torsional oscillation despite being a straight type tip. We used a high-speed camera to record the cavitation that comes out from the torsional PEA tip and the end of the Propeller Turbo Tip, and we verified those images. With the torsional PEA tip, the entire tip moves vigorously, causing cavitation toward the outside of the tip. However, with the Propeller Turbo Tip, cavitation is caused only in the plate part. We therefore feel that it has a minimal effect on the outside of the tip, or in other words, on the ocular tissue. Next, we used a simulated nucleus to perform simulation of crushing. While the tip for torsional PEA has outstanding crushing speed, nuclear fragments are scattered and the nucleus moves in a complicated manner. However, we found that a Propeller Turbo Tip crushed and aspirated the nucleus smoothly and silently. As you can see, the new Propeller Turbo Tip is truly outstanding. Next, we'd like to show you a clinical example. The subject's nucleus has grade 2 hardness. A Propeller Turbo Tip, which is a straight type device, can accommodate conventional surgical techniques. Thanks to the plate that is installed inside the tip, crushing and aspiration of the nucleus can be performed with torsional oscillation alone. Since the pointed end of the tip has rotational movement only and no left-right vibration, the ocular tissues are not affected. Closure and aspiration can also be performed easily, even with the nucleus having a hardness of grade 3 or higher. If the nucleus is hard, fragments may sometimes become clogged. In this case, the torsional power should be set to 100%, with slight vertical vibrations used as well. Finally, we used a porcine eye to perform a posterior capsule survival test. An experiment was carried out with the posterior capsule completely closed and aspirated, and the torsional power was raised in stages. If a torsional PEA tip was used, the capsule would break with torsional power of between 20 to 30%. Since the entire tip vibrates sharply from left to right, the capsule broke, even with low torsional power. With the Propeller Turbo Tip, on the other hand, the capsule did not break, even when the torsional power was raised to 100%. This was because the end of the tip has rotational movement only and does not move from left to right. Technologies and instruments have, up to now, been developed in search of high surgical efficiency. However, there is now a call for devices that cause minimal invasion to the ocular tissues, even though the procedure may take extra time. The Propeller Turbo Tip is a next-generation phaco tip that has little influence on the ocular tissues, is not liable to cause breakage of the posterior capsule, and is friendly to both the operator and the patient alike.